Hi everyone. Today I want to talk about a common pregnancy complaint, and that is SI or sacroiliac joint pain. So this is your pelvis, the backside here, and right here where these dimples tend to be is where a lot of people point to SI pain. So a lot of times people complain that they have more pain when they are rolling around in bed or getting dressed standing on one leg, really doing any kind of single leg stabilizing activity there. So the reasons why we tend to have more SI pain during pregnancy are because of hormonal changes, right? So that relaxin hormone that kind of helps keep those joints mobile for labor and delivery can actually cause some instability in those joints. Another reason is because of glute weakness. So sometimes during pregnancy too, we're really not working on our glute strength and doing a lot of squats and things like that that can really help keep our glutes strong. And then the last one can just be gaining weight. So when you gain extra weight, you have more force on those joints. So that can be a reason also why you're having some SI joint pain. So some things to avoid if you're experiencing SI joint pain are any single leg exercises, okay? So that can be like a split squat, a lunge, getting dressed where you're standing on one leg and using the other one to stabilize, any kinds of workout machines, so elliptical or Stairmaster, a lot of impact, so running, any kind of impact that increases the forces on our pelvic joints. We want to minimize that as well. So we really want to limit those. We also want to limit deep stretches. So things like a deep figure 4 stretch or a pigeon pose that's actually going to kind of distract the joint a bit and can pull that joint out a little bit more. The other thing you want to avoid doing is sitting with your legs crossed. Okay, so what happens when you cross your leg like this? It actually widens the top of the pelvis or the inlet here. So what we don't want to do is widen this part anymore. So by crossing your legs, you're going to be doing that. So you want to make sure that when you're sitting with a good posture and with your legs straight in front of you. Some things to help treat SI pain. Obviously, come to a pelvic floor therapist so we can assess your body specifically, but making sure that you have good posture, right? So we don't want to be overarching our back like this. You want to make sure that you are nice and stacked. You don't want to be tucked under, but you do want to make sure that those forces in your posture are aligned well. Making sure that you can breathe into your rib cage well, you have good rib cage mobility, and then exercises that are going to help to strengthen your glutes. That's really one of the things that we work on, along with inner thigh mobility and stretching there. So ask your pelvic therapist for some specific exercises, but I will give you some also that you can do. We also want to be mobilizing your glutes. So using a lacrosse ball against the wall, getting into some trigger points here can help release some glute tension that might be distracting the joints a bit. And then lastly, the Sorolla belt, which I have another video on how to use it, but this can also help, you can see here, keep those joints together. That can be really beneficial if you're having some of that instability, especially when you're walking like uphill or up and down stairs. It can kind of just help hold the pelvis together. So stay tuned for some exercises.